Dr. Melody Covington. I am Medical Director and owner of Abundant Health and Vitality Associates Medical Weight Loss Clinic in South Park, Charlotte, North Carolina. Okay, so we're going to talk about the different ways that we measure in a weight loss clinic. Everyone knows weight, right? But weight is just weight. So weight weighs your entire body, including blood, skin, hair, all of that stuff. It's important to see which way that you're trending, but what we use to know what that breakdown is going to look like is actually body composition. So we do have a body composition scale in our clinic. Every single patient that comes in gets weighed on our scale and has a printout that documents the breakdown for what does that weight actually mean. So I'm just going to give you a couple examples. We do calculate or measure fat percent, fat mass, fat-free mass, that's anything outside of fat, so bone, blood, skin, that type of stuff, muscle mass, total body water, the bone mass, and then basal metabolic rate. There's a couple other measurements on here as well. The significance of a body composition is, like I mentioned, it tells us what that weight is composed of, but as individuals are losing weight, it also gives us some insight into what are they actually losing. In weight loss, it's most important to lose body fat, excess body fat, because some fat is important for hormones and temperature regulation and other types of things. So we don't want to lose 100% of our body fat. We want to bring the fat down into normal percentages for both male and female. Body composition can also help to explain when we see weight plateaus. Sometimes we get frustrated when we don't see the weight move, the scale move, and we can look to body composition to see my percent body fat is actually going down and my muscle is increasing, or I'm hydrating much better, my water percent is increasing. So it helps to give us some more clues into exactly what that weight means. The other thing that body composition also tells us is it can give us some comparisons to things like BMI. We know that body mass index is not 100% accurate, so it gives us another way to assess patients in terms of their weight. Are they at a healthy weight? With BMI, which is also on this body composition sheet, BMI is weight relative to height. It does not take into account race. It also does not take into account body mass. As physicians, we do use BMI as a guide, but we know that it's not going to be 100% accurate. We have to physically look at the patient in front of us, have a discussion, and ask some questions. I tend to lean more towards fat percent to tell me, what amount of weight a patient needs to lose, more so than BMI. Other ways that we measure in our clinic is inches. Now that's something that's super simple. You can get measuring tape that costs less than $2 and measure waist, hip, neck. Those are the three places that I measure clinically, but you can also measure in other places like calves, thighs, etc. And you can monitor, especially for waist to hip ratios, are these areas are they getting smaller? That tells us some insight for visceral fat. That's the fat around the organs. And sometimes it's always fat that you cannot see, but sometimes you can see some subcutaneous fat as well around the midsection. So we're able to measure there as well. And in my clinic, I measure every other visit or every 8 weeks for patients. Because again, the scale does not give all of the information. So sometimes we see plateaus on the scale, but we can do waist measurements and see that individuals are actually shrinking. And we can also see that in clothes as well. If someone's clothing sizes are getting smaller, then we're definitely shrinking. So a common question that I get when I go through body compositions with patients is ideal body weight. Everyone wants to know, what am I supposed to weigh for my age and for my height and for my race and all of that good stuff, and my gender. We do have ideal body weights. However, I'm going to tell you that I do not abide by them 100%, and I do not think they're fully accurate. So for example, for this 5'2" female, the ideal body weight is 120 pounds. What I typically do with ideal body weights is add 10 to 15 pounds, because the ideal body weights are from the 1950s, which was not necessarily that long ago. But what's important about looking at that population, if we were to to skew our population. They were shorter and did not live as long. So the ideal body weights the last time that they were populated does not really apply to us. So we have to be very careful with allowing very old, outdated information to guide us in what's normal for us in 2022. So thank you so much for watching. I hope that you really enjoyed this video.